Hello, everyone, and welcome, and thank you for tuning in to Health Leaders, the place for peer-sourced and solution-focused insights for healthcare executives. My name is G. Hatfield, and I'm the nursing editor for Health Leaders. Today, we are speaking to Terry Dillman, who is the Vice President and Chief Nursing Officer at Plainview Hospital and Syosset Hospital at Northwell Health, about her career and her thoughts about trends in the nursing industry. So, hi, Terry, how are you?
Hi, G. How's it going?
It's good. It's good. It's hot where I am. I'm down in Houston, so it's like 100 degrees.
Oh, I can imagine. I want to thank you so much for this incredible opportunity
Of course.
to represent a profession that is near and dear to my heart. So thank you.
Absolutely, of course. And let's get right into it. How did you begin your journey into nursing?
Oh, that's a great question. So, first and foremost, my journey in nursing didn't, begin with certainty, but more of a calling that I couldn't
Hmm.
ignore. I grew up not knowing I wanted to be a nurse, but knew that I loved helping people. Unfortunately, I grew up with two very sick parents,
Hmm.
in which my father passed away from cancer. And
I'm
I
so
remember
sorry.
going through high school, college, volunteering in high school, and just being simply that, one person that friends turn to in a crisis. I love to heal, whether it's emotionally, physically, and that's where I felt closest to home.
Hmm.
But the moment it clicked for me, it was when I was 16 years old. I was in high school, and my mother went into the emergency department, and she had what's called a perforated diverticulitis.
Mm.
It was a regional level one trauma center. People were fast moving in these black scrubs, and I was scared out of my mind,
Hmm.
but there was a style, a confidence, and a grace. And I remember saying to my mom that night, that is what I want to do.
Hmm.
That is who I want to be. So
Yeah.
from that moment on, I knew I wanted to go to nursing school. 3 days after high school, I went to Queensborough Community College. I'm one of seven kids.
Hmm.
And so the first class over the summer was free. So free was for me. And I went to Queensborough, graduated at 20 years old,
Hmm.
worked full time, long nights, emotional tolls, but I knew what I wanted and I refused to give up. So nursing is not just a career for me, it is a passion, it is an identity. It
Hmm.
taught me resilience and compassion and the power of presence. And so, from time to time, I always have to remind myself, but my teams do that for me.
Hmm.
And then I started as a emergency department nurse at a regional level one trauma center and a sexual assault nurse examiner.
Wow,
uh,
yeah.
20 years at Northwell, and through different progressive leadership roles. I was an A&M, off-shift administrator for hospital operations, uh, PACU nurse manager, director of peri-op, Magna program director, cardiac director, senior director, and a CNO for the last 4 years. And I was a CNO at Glen Cove Hospital, and recently, in the last 2 months, transitioned to be the CNO of both Plainview Hospital and Syosset hospitals.
That's amazing. Yeah. Well, that sounds like you've had an amazing career so far, and I'm really excited to see you continue. Something I love so much about the nursing community is that it's such a passion for so many people,
It is.
because that can be rare in professions.
It can be
So it's pretty
rare,
cool.
and it takes, we have an obligation, whether it's a nurse or
Hmm.
a leader, to make an impact. And that's why
Hmm.
we're here, and we can never forget that. And I will never forget the people that have
Hmm.
helped me to be where I am today, whether it was at the bedside and it was my preceptor as a new grad,
Hmm.
or, my educators, etc.
Absolutely. Well, talk to me about some of those people who've been some of your biggest influences.
Oh, that's a phenomenal question. And I'm going to answer this question right by not giving names, because if I included any names, I refused to insult anybody that made a huge impact on my life. But I'm going to be very honest. I
Mhm.
did not want leadership. I was an
Mm.
emergency department nurse. I loved what I did. I was in my dream job. And for, almost 9 months, I debated whether or not to take the job as an A&M.
Mm.
And I'm going to share, I went out into the ambulance bay, and I'm going to get vulnerable with you.
Mhm.
I called my mother.
Mhm.
And my mother said, don't do it. Your heart is too big. You're going to get taken advantage of. I was
Mm.
23 years old when I tragically lost my brother. He was in a manhole explosion.
Oh, I'm so
And I
sorry.
looked in the sky, um, and that was Georgie telling me to apply. And,
Mhm.
ironically, he was applying to be the supervisor at Con Ed before he passed away. And so I'm not only living, my dreams, I'm living it for the both of us. And
Mhm.
so when I started, there was an executive director who, she was so fierce and badass. And I shouldn't
Mhm.
say that, but her compassion and unwavering, integrity. She knew every single person's name, right? She
Mhm.
didn't just round to round on certain patients, but she rounded with purpose, and never made a decision without asking her teams. I mean, we had night leadership rounds, etc. And what struck with me
Mhm.
was her ability to stay calm and lead under crisis, not with a panic, not, speaking in a certain way, but advocating and reminding us why we do what we do in a professional way.
Mhm.
And she reminded me that leadership is not about titles, right?
Mhm.
Because you can lose that title very quickly,
Yeah,
but it's about relationships and trust. But most
absolutely.
importantly, showing up when it's hard,
Mhm.
not just when it's easy. And we're responsible for creating that culture to feel safe and valued, to do our best, but also to
Mhm.
provide the resources. And I will share this one leader that I'm specifically talking about. I was actually on a panel discussion recently, and she was a guest in the audience, and she's now
Oh.
retired. And it
Mhm.
was like a celebrity crush, and I couldn't believe that she was in the audience. So she and many have shaped my career. I'm
Mhm.
also going to mention when you look at influence and you look at mentorship, in nursing, I'm going to challenge you, and this might be a divergent thought process, but you should have multiple mentors
Mhm.
and people that impact your career. You shouldn't just have one, because you're getting different support and guidance and sponsorship from many different disciplines. So depending on my role, I had chair of cardiothoracic surgery as a mentor, or head of
Mhm.
human resources that made a tremendous impact on my career. So get that global perspective, so we're not just narrow minded inside the four walls of nursing, but that
Mhm.
we can help and support our physician colleagues, or nursing, or ancillary pharmacy, whatever it may be. Have that open mindset is
Mhm.
definitely my recommendation. And I want to thank you all, my sponsors and my influencers throughout my career. I am where I am today because of you, and I could not do it to today if it wasn't for you. So thank you all.
Absolutely. So, speaking of when times get a little tough in nursing leadership, what was your best mistake and what did you learn from it?
Oh, that's a great question. And I think it's important first to identify that you have mistakes. You
Mhm.
make mistakes. It shows that you're humble. It does sting.
Mhm.
But I will, I'm going to bring up an example in my earlier career. I think one of my biggest mistakes was trying to lead in a place of perfection,
Mm, mhm.
instead of authenticity. So early in my leadership career, I believe that I needed to be there, know all the answers, stay calm in every storm, be the fixer of every problem. And I might
Mhm.
not have had the answers, right? But I thought that's what strong leadership looked like. But by doing this, I unintentionally created distance with a leader that I really respected.
Mm,
And I missed an opportunity to connect and listen, and partner in that regard,
mhm.
because you're not making decisions in silos. And the turning point was a particular staffing crisis situation where I made a unilateral decision in isolation, thinking
Mhm.
that I was protecting the team and that leader from stress. But instead, they felt that they were excluded and unheard. And that
Mm,
wasn't the intent.
mhm.
But that moment taught me that leadership isn't just about shielding people. It's about standing with them shoulder to shoulder and working through it together and listening to understand. And most importantly, knowing that I do not have all of the answers.
Mhm.
Nobody does.
Yeah.
And I also encourage you to make mistakes, because if you're not making mistakes, you're not taking risks, you're not trying to be innovative. So
Mhm.
since then, I really learned about vulnerability, being
Mhm.
more curious, building trusting relationships with our leaders, not pretending to be perfect because nobody is, and
Mhm.
having that safe space to grow. What that does, you're creating a better culture, you're
Mhm.
creating better outcomes, and most importantly for me, it helped my own sense of purpose
Mhm.
from a team perspective.
Absolutely. So, obviously, you have a lot of experience in the nursing industry. So, what do you think are some of the biggest challenges that are currently facing CNOs and CNEs in 2025?
Oh, so that's a great question. So I want to first say, is it a challenge or is an opportunity? And so
Mm.
that
Mhm.
is really the motto from our president and CEO of Northwell Health, Michael Dowling,
Mhm.
who has made a profound impact on my career.
Mhm.
Don't look at things as problems and challenges, but opportunities. And so navigating the landscape with resilience,
Mhm.
innovation, and advocacy. So I'm going to break it down into a couple components for the team. First, it's the workforce,
Mhm. Yeah.
the shortage, but the ability not to have that shortage and build retention strategies so we can keep our workforce longer, and
Mhm.
have innovative practices regarding that. Understanding the demand for nurses is continuing to outpace the supply. Early retirements. How can we
Mhm.
change that motto? How can we bring them back in a different capacity? Shrinking the pipeline, I think, is important to notate.
Mhm.
CNOs have to balance retention and recruitment, and making sure that we're looking at keeping our own. And, we're blessed to have contracted nurses and travel nurses come in when there is pandemics and stuff like that. But balancing that, I think, is extremely important, and growing your
Mhm.
own. Most importantly, in the economy that we're in right now, it's the financial constraints, right?
Yeah.
So as
Mhm.
CNOs, we're leading under a tremendous amount of pressure to maintain high quality of care
Mhm.
with extremely tight budgets,
Yeah.
rising labor costs, and declining costs in reimbursements. And we're seeing that all across the nation. Everyone is
Mhm.
seeing that.
Yeah.
So every staff decision and tech decision, must have an ROI, and that's important. And then to make sure we're advocating for patient safety and quality, but also making sure we're balancing the finance and partnering with our finance colleagues, because they have a great ideas too. And so
Mhm.
if we partner and have those relationships, we really can build better models. And so I think that's important to understand. I mean, as leaders, you have to understand the finances, right? Because that is also your obligation.
Yeah.
I'm then going to mention workplace violence and safety.
Yes. Yeah.
And over half of nurse leaders reported witnessing workplace violence, bullying, incivility, etc. So I think it is vital as chief nursing officer to expand and lead prevention efforts,
Mhm.
support traumatized staff, advocate for stronger prevention, and we can talk about that in a few. But then when you look at the regulatory and compliance pressures that are coming our way, so understanding that, and
Mhm.
and building the tools and resources to make it easier for our teams, so we don't have clinical documentation burden, and we're not replicating things and doing it on paper, and we're taking IT to make it easier for our teams and having that value added. And so I'm going to say technology enhancements,
Mhm.
understanding the tech, streamlining workflows, poor implementation, right? It increases team members' frustrations.
Mhm.
So, how do we implement user friendly systems and provide trainings? At Northwell, we're transitioning our EMR to Epic,
Mhm.
which is an incredible opportunity for us in the work that we're doing to enhance care,
Mhm.
streamline documentation and efficiencies. And I promise you it's going to be epic, but upfront, I had to. Sorry, Jay.
It's
Um,
alright.
Looking at leadership turnover and succession planning, we have
Mhm.
to take a proactive approach. Many leaders, themselves are reevaluating their roles.
Mhm.
Nurses, stepping into a leadership role. Succession planning is critical, and there's a major opportunities, especially with CNO roles, right? So
Mhm.
how are you building that succession planning? And it
Yeah.
can't be when the individual is retiring in the next year. That should have been happening years ago, and building that, that's successive and progressive. And so doing things like 9 box talent assessments, looking at 1 year to 5 years out, and it's our job and our obligation to prepare them with the
Mhm.
tools and resources. I personally believe, right, we need to be asking about career pathways,
Mhm.
and supporting them to get there instead of saying, oh, nope, you got to start in med surge. You have to. So we're telling
Mhm.
people to start in med surge. And, med surge is incredible, but if somebody wants to be in ICU, don't push them into area that they're not passionate about, right?
Mhm.
Provide that career placement and the tools for them. And it's our job to operationalize where they want to be. So, then there's health equity and DEI. And I know that is a very political, a statement in the climate that we're in, but really addressing, social determinants of health, leading DEI initiatives. We had an
Mhm.
incredible Juneteenth event today
Mhm.
with system leaders across the health system, really providing awareness and education and celebration to our teams. And so
Mhm.
that's, increasing our cultural competence, really having inclusive leadership and really not just saying it, but
Mhm.
having a systematic change in place. So really, I'm going to say we got to continue to be visionary.
Mhm.
We got to continue to be crisis leaders, be financially savvy and smart, and
Mhm.
creative.
Yeah.
Um, and be continuing to be culture builders so our teams want to stay,
Mhm. Yeah.
and they feel supported, they feel valued, they feel that they're involved in the decision making process that affects their work. So I think it's all of that in one. So I hope I answered it correctly.
Yeah, absolutely. There's several topics in there that I want to follow up with you on. First and foremost, you mentioned recruiting and retention, which obviously there's, a pretty big workforce shortage across the country and globally as well for nurses. So what are your thoughts on successful recruitment and retention strategies? And also you mentioned DEI. How can you incorporate that in those
Absolutely.
processes?
So it's a few things on, strategies for recruitment and retention.
Mhm.
Let's not make the shortage worse,
Mhm.
and provide the different strategies to keep our teams,
Mhm.
to retain them. So first, let's talk about recruitment, and that's attracting the right talent. So you got
Mhm.
to start early. So you start them in elementary school, right? High
Mhm.
school, the
Yeah.
community colleges, promote purpose, and a dynamic career, offer
Mhm.
scholarship, grant opportunities, shadow program, early exposure into these clinical environments. So building these healthcare exploration programs so that they can see it themselves.
Mhm.
How do we expand education access? I think that's extremely important, especially with, we talk about shortages, the lack of faculty in these schools of nursing. So
Mhm.
how do we support the nursing schools with funding, increase lab simulation, enrollment capacity, building dedicated education units? So we're utilizing our educators, at the hospital support that clinical experience for our nurses. So we're partnering with the schools of nursing,
Mhm.
and instead of competing at times. How do we provide, competitive packaging? So really, I'm so proud to work for a health system that values, our people, and having so much opportunity at our fingertips for tuition reimbursement, free tuition opportunities, clinical ladder professional development programs, certification enhancements. So, and those are some of the things, to mention
Mhm.
when we look at a recruitment strategy. We have nurse externship programs.
Hmm.
We built a program that is an R1 program with nursing students that
Mhm.
will be hired per diem, that start as ancillary team members, whether you call them a PCA, an NA, etc. So they
Mhm.
get that human connection. They learn how to do vital signs, and it builds their confidence while
Mhm.
they're in nursing school and helps support their competence. So I think, being creative like that and thinking outside the box. How do we retain? And it's
Mhm.
keeping our nurses empowered and engaged. So,
Yeah.
prioritizing their support, providing wellness days and
Mhm.
activities for them, peer support, providing the appropriate onboarding with
Mhm.
the preceptor that wants to precept,
Mhm.
to leave a legacy, and to support their growth. And I mentioned this earlier, creating clear career pathways for our team when they start. So that's,
Mhm.
if they want to start in the ICU and they want to be an NP or a CRNA, that is okay. And we
Mhm.
have to embrace that. That
Yeah.
is absolutely okay supporting them. Offering mentorship program, leadership training. So one of the, I'm very passionate about, and because, it was something I studied in my, DNP, is building leadership development programs. And so we built a transition to practice for leaders and giving them the didactic training with the tools and resources to help simulate them to the environment quicker with more confidence. And then we evaluated their self-efficacy rates.
Mhm.
And if we have effective leaders, right, I think that 100% definitely supports engagement and empowering of our team members. So how do we build a culture of belonging, right? And
Mhm.
so I always value engagement with three topics: effective
Mhm.
communication. Effective communication. If you think you're communicating enough, you're not, and it needs to be
Mhm.
in a multimodal approach,
Mhm.
especially with our different generations. The second is, how do we recognize meaningful recognition, and whether it's formal programs, whether it's informal on your rounds, whether it's an email. So I carve out every Friday, and
Mhm.
I email 5 team members, right, to let them know they did a job well done, whether it's a good catch, a quality, a patient experience comment. That is important. You want your nurses to feel seen, valued, and heard.
Mhm.
And then last but certainly not least, as a nurse, as a clinical team member, regardless of your role, am I involved in the decision making process that affects my work? Right?
Mhm.
Involve them from the beginning. I had a great idea, from a team member today, and they said, "Can you come to the ED?
Mhm.
I want us to make sure we're doing EKGs within 10 minutes. Um, why don't we have a spot right in triage with a recliner and an EKG
Mm.
machine?
Mhm.
So once I do the triage, I can do an EKG at the same time." And I'm like, that's brilliant. And
Mhm.
all I did was walk to the ED and listen to the clinical nurse. And you would have thought I gave this clinical nurse $1,000. I mean, the facial expression, filled my heart. And
Mhm.
that's what this is about. And there's a lot of
Absolutely.
stresses as leaders, but this is what it's about. And so I'm going to say, listen and act. Listen
Mhm.
and act. Listen to your team members. Be visible, approachable, accessible, and
Mhm.
I think most important, relatable. And then you take data and innovation and staying ahead of that, leveraging AI. I mean, it's so cool the things that are out there right now with smart technology,
Mhm.
reducing administrative burden. Everybody makes fun of me. I do the voice to text on my cell phone, so I don't text, when I'm driving,
Mhm.
listening, doing, stay interviews, 30, 60, 90 exit interviews.
Mhm.
How do you engage former nurses to return to practice? They are the brain power. They have the
Mhm.
knowledge. So maybe they can't do the physical aspect, being on their feet for 12 hours, but you better believe there's roles out there and we can accommodate
Good.
these nurses to come back into the workforce in a different capacity. But
Mhm.
we have to have an open mind to do that. And I'm going to say, how do we lead with purpose, right?
Mhm. Yeah.
Making retention a strategic priority on your nursing strategic plan,
Mhm.
because and honestly, tying nursing satisfaction, retention, and recruitment as part of executive performance metrics
Mhm.
that we're looking at. How do you empower these nurse leaders? And you have to equip them. I mentioned that earlier, so I won't pontificate on that. But then how do we leverage policy change and pushing for federal, investment in education? And we talked about that earlier, from a workforce safety, from a workforce development,
Mhm.
especially in the times that are, happening right now.
Absolutely. And I'm so happy that you brought up nurse well-being, because the burnout statistics among nurses are pretty staggering. So part of that, as you mentioned as well, is workplace violence. So what are some of your tips for workplace violence prevention and also just how to support nurse well-being?
So that's a phenomenal question, and I'm going to take this in a two-part. Um, CNOs, chief nursing officers, play a pivotal role in preventing workplace violence. Supporting our
Hmm.
nurses can't just be in the aftermath. We have to
Hmm.
take proactive approaches that are compassionate, and that our team knows we care about it. And first and foremost, it's establishing a zero tolerance culture, making it clear that violence, both verbal and physical, is not part of the job. And it starts
Hmm.
with strong policies,
Yeah.
visual signage, um, consistent support, reporting to law enforcement. Our president and CEO, I'm going to bring Michael Dowling, him taking such a powerful stance on gun violence across
Hmm.
the nation, right?
Hmm.
Most CEOs won't even take that on because it's so provocative.
Yeah.
Um, but no, we're not scared of that, right? Because, we're
Hmm.
saving lives by doing that. That is a healthcare crisis, and we have to
Hmm.
look at it like that. I am blessed to have collaborative partnerships with security and emergency management at our site. So we're always looking at it each month in our workplace violence councils, and so safety infrastructures. We have three-way cameras throughout our entire building.
Wow.
We have panic button surveillances that we're working on. We're looking at different technologies currently in place to deter and detect threats. We do have armed security in our building that's rounding in our building 24/7,
Hmm.
and it's powerful. We did a lot of work around de-escalation training of our staff, to equip them with early warning signs to how to, diffuse tension, and
Hmm.
seeing these behaviors and building a behavioral response team. We do a ton, and I want to thank my emergency management team. We do a lot of active shooter drills, bomb, simulation trainings, behavioral patient mock simulation, to
Hmm.
help our team members, and that's really important. And then continuing to design safer environments. So, and we do that when we build any unit and we're looking at it. Facilities and security are involved in the design and the decision. So that's improving lighting, access points, eliminating blind spots,
Hmm.
and I think those are a few. And making sure we immediately respond. I remember a workplace violence that occurred, and I fully supported my nurse. You should be calling law enforcement.
Yeah.
And the incident happened. I called her within 5 minutes. I was actually leaving a meeting at corporate, and then went right to her room to check on her. And to this
Hmm.
day, she continues to tell me how much that meant to her. So
Oh,
showing up
yeah.
and being there,
Hmm.
providing that culture and training, tracking and analyzing the incidences for tracks and trends, increase and decreases, and then making sure that we're engaging our frontline voice. And you're going to see that as the theme of
Hmm.
today's conversation. So safety doesn't become physical, but the nurses need to feel safe,
Yeah.
and if they do, we have to let them voice their concerns without fear, and really having what's called like a just culture methodology.
Hmm. Absolutely. And speaking of nurses using their voice, obviously, a few of the things we've talked about, there's some contention about some of it in today's landscape. So, how do you think CNOs can get involved in the legislative process to advocate for nursing? Because, there's all kinds of different things that are trying to get passed right now. So,
Oh my God. So, is this falling on, if you don't mind, I'll enhance, right, the workplace violence,
hmm, yeah.
right, topic. Let's take that as an example. We have advocacy day. We have to promote our nurse leaders and as nurse execs to get involved, right? Because depending on the legislation, they're not clinical. They don't understand. We
Exactly.
have
Yeah.
to, explain what's going on in reality, and understand that workplace violence is not in a nursing, it's not just a nursing problem, but it's a national crisis.
Hmm.
Nurses are, the statistics say they're 5 times more likely to get assaulted on the job, right?
Yeah.
So, we've heard right now the reintroduction of the Workplace Violence Prevention, Healthcare, and Social Work
Hmm.
Act. I think that's a critical step forward. We need to move forward. That
Hmm.
lets the world know that federal action sends a clear message to our people, right? That
Hmm.
violence in a healthcare place is unacceptable, is preventable, and it should be punishable. And
Mhm.
so, looking at that type of stuff, getting involved at state level, but even taking a step back, because that might be very intimidating, right? Oh my God,
Mhm.
I'm going to go to Albany. I mean, I can't,
Yeah.
right?
Mhm.
Start with your local professional affiliations. If you're an emergency department nurse,
Mhm.
start and get involved in the Emergency Nurses Association.
Mhm.
As a nurse exec, I'm heavily involved in AONL, right?
Mhm.
So getting involved, even at the state level first, with your professional organizations, I think is the first step forward, to build your confidence and your competence, even if you don't feel comfortable to go to, legislation or Albany. Remember, every small step
Mhm.
becomes a bigger step to where you want to be and our advocacy for our teams.
Absolutely, yeah. And then you mentioned this a little bit too, so I wanted to pick your brain about it.
Of
What are
course.
your thoughts on AI? What are you excited about with that?
Oh my God. I mean, honestly, that could be probably a 3-hour conversation. So I mean, I love AI. I think
Mhm.
technology is changing the landscape and how we shape our profession. But I
Mhm.
want to be very clear on my response. It will
Mhm.
not replace teams. It is
Mhm.
value added to enhance the work that you're doing every single day. I
Mhm.
understand so often there's this misconception, or these unconscious bias, like, oh, these robots are going to replace.
Mhm.
It's not.
Yeah.
It's to enhance your efficiency in the work that you continue to do every day, right?
Mhm.
So you hear things like ambient listening, right, in the
Mhm.
room, and then you have voice to text in the EMR, right? How do you use AI, which is pretty incredible, where AI is helping nurses depict patients deteriorating and
Mhm.
streamlining that documentation, which
Yeah.
helps assist with clinical decision making, and not delaying, care for a patient that could be decompensating.
Mhm.
Incredible stuff, with wearable health devices. My brother is a type 1 diabetic. So, I mean, he would hate that I said that, but, smart watches, biosensors, vital
Mhm.
sign machines, right? That, our patients and the community can better track, and deal with, chronic disease management. We have telehealth,
Mhm.
right? And telehealth was very provocative during the pandemic, if you remember
Mhm.
correctly, right?
Yeah.
It's a
Yeah.
permanent fixture in what we do every day.
Mhm.
And nurses have the ability, and physicians and ACPs, to assess, educate, follow up virtually, expand access. I'm going to give an example. I'm 14 weeks pregnant. And so, in the crazy life of a 24/7 CNO, right? I had
Mhm.
a telehealth
Yeah.
appointment with my genetics counselor, at 6 p.m. in my office. It was
Wow.
smooth. It was easy. It was efficient, right? And in the world we live in today, everyone wants ease and access right at your
Mhm.
fingertips.
Yeah.
So I'm a huge supporter of smart beds. You're seeing robotics. You're seeing virtual reality and acute rehabilitations to help with exercise and moment, and movement.
Mhm.
But it's like gamification in a fun way.
Yeah.
You're looking at electronic medication management systems. I mean, I really can go on for, like, the next 5 days with this.
Mhm.
I think people are scared
Yeah. Yeah.
because of the unknown, or they might not necessarily be tech savvy. But I just embrace keeping an open mind, an open heart, learn something new every day, because AI, this tech, um, it's here to support you to actually reduce your workload, your
Mhm.
documentation burden, and your life's easier.
Yeah.
If I could give a simple example, right? When I first, I have no sense of direction, when I drive places, right?
Mhm.
Look at GPS.
Yeah.
You remember the
Yeah.
old Tom Toms we had, and where we've come to today? I mean,
Yeah.
we have to step back from the old flip phones to now the new iPhones, right? It's
Mhm.
inevitable. And just keeping an open mind to the changes that occur, and what it can do for you, both professionally and personally.
Absolutely. Yeah, I love the GPS example. I remember my dad on road trips when we were kids with the paper maps,
Yes,
trying to figure it out.
my dad too. I remember when I
Yeah.
got my first Tom Tom, I was so
Yeah.
excited.
Absolutely. So, to pivot back to you personally, what are you most proud of?
Wow, that's a loaded question. There's so much to talk about. I think, as a chief nurse exec, I am most proud to lead people.
Mhm.
People are my number one priority. I
Yeah.
love people. So leading with confidence, compassion, respect, elevating clinical excellence. It's not just about improving the patient, outcomes. Yes, that is our priority. But how do we nurture teams to grow professionally, providing them
Mhm.
access and opportunity to professional development where the teams feel heard, seen, valued. I've seen in practice, right? A brand new nurse, their first day on the job, a deer in the headlights, so
Mhm.
scared,
Yeah.
to when they're off of orientation and they're building, right, their competence, not necessarily their confidence, right? And that takes time as they grow. I've seen and helped seasoned nurses rediscover their passion and their purpose, right?
Mhm.
And whether it might have been in a different role, but seeing that sparkle come back in their eye. And I'm giving another example. I stood shoulder to shoulder with these nurses and our teams during crises and some of our darkest times. And that was the pandemic, whether I was
Mhm.
putting in
Yeah.
IVs or ambuing patients in the ICU, but being there. And again, I said this earlier, showing
Mhm.
up.
Yeah.
But I think what inspires me the most is the ripple effect of the work that we do to
Mhm.
provide better care for our
Absolutely.
families, providing them peace, letting our nurses understand the value that they bring. I always say, whether you like it or not, you will be a patient in that bed, or somebody that you love will be a patient in that bed. And
Yep.
how do you want to be treated? And I think
Mhm.
that is so important. And so I know I'm giving a couple things, but most importantly and honestly, I think my greatest pride has been watching somebody that I've mentored um, doubt themselves,
Mhm.
that they don't have the confidence to go into a leadership role. But because and team took the time to believe in them
Mhm.
and watch them flourish and grow right in front of your eyes is probably some of the proudest moments I've ever had. It is not about you.
Mhm.
In any leadership role, not even just in a CNO role, you have to have the desire to want to be there and to grow others. And that in turn will give you instant gratification for the
Mhm.
work that you do. I love what I do. I am so
Yeah.
blessed to, care for not only my nurses, but the patients, the communities, my leaders. And every day I try to be better than I was the day before for
Mhm.
everybody.
Absolutely. And then do you have any words of advice for other CNOs?
Oh, yes. I think the first advice I would say is knowing that you're not alone.
Mhm.
We are in this together, regardless of where you work, the hospital, the health system, etc. We must be in it together. Phone a friend, know that we're here to support each other, sharing best practices. And it's hard work. But it's really, really rewarding when you see the impact of your nurses, your attention strategy, your engagement, the clinical outcomes of your patients. So don't give up, keep going, and phone a friend.
Yep.
Build your network of resources, build your pool. We're all in it together.
Mhm. Absolutely. Well, that's a beautiful note to end on. So thank you so much, Terry, for
See,
your
thank you
time.
so much for this opportunity. It's
Of
such an honor and a
course.
privilege.
Yeah, I'm so grateful to have had this opportunity to get to know you and hear your insights. And thank you so much to everyone in our audience for listening. Thank you, Terry.
Thank you so much. Have a beautiful day.
You
Keep
too.
shining.